All right, today we're tackling a fascinating medical puzzle, one where doing the thing that seems most obviously helpful can actually be incredibly dangerous. Let's dive right in. So imagine this. You see someone, and they are really struggling for breath. I mean, what's the first thing you think of? Give them oxygen, right? Pump up the O2. It's just common sense. But what if that common sense answer could actually be fatal? Yeah, no joke. For millions of people, that exact move could have devastating consequences. And that's the paradox we're going to unpack right now. Why more isn't always better when it comes to oxygen. To get to the bottom of this mystery, we first need to talk about the condition at the center of it all. And that's COPD, or Chronic Obstructive Pulmonary Disease. Okay, so what exactly is COPD? Well, it's not just one single thing. Think of it like an umbrella term for a bunch of lung diseases that all do the same thing. They block your airflow and make it harder and harder to breathe over time. And a key thing to get here is that the main problem isn't just getting air in, it's getting air out. Under that COPD umbrella, you've got two main troublemakers. First, there's chronic bronchitis. That's when your airways get all inflamed and gunky with mucus. Then you have emphysema, which is when the tiny little air sacs in your lungs actually get destroyed. They work differently, but they both lead to the same terrible result, a nonstop fight just to breathe. So, what causes this? Look, the number one cause, and it's not even close, is smoking. But it's not just smoking. Think about long-term exposure to nasty stuff like air pollution, fumes at work, or even smoke from cooking fires in some parts of the world. All of that can contribute. And there's also a very rare genetic piece to the puzzle for a small number of people. All right, so we've got a handle on what COPD does to the lungs. Now let's get back to that big central question. Why on earth is giving someone with severe COPD a blast of oxygen so dangerous? The whole secret is this. The body has adapted. You have to understand, after years and years of struggling to breathe, the body of a person with severe COPD has basically rewired itself. It's learned to survive in a state that's low on oxygen and high on carbon dioxide. It's a really fragile, delicate balance. And when you come in and just blast it with high-flow oxygen, you throw that entire finely tuned system into complete and utter chaos. Now, this chaos really boils down to two main things happening in the body. They've got some kind of nerdy-sounding names, VQ mismatch and the Haldane effect, but I promise the concepts are actually pretty straightforward once you break them down. So let's do that. Okay, culprit number one, the VQ mismatch. Your body's pretty smart, right? In a lung damage by COPD, it knows which parts are broken, so it cleverly shuts down blood flow to those useless air sacs. It's like closing the roads to a factory that's gone out of business. This is great. It means blood only goes to the parts of the lung that can still do their job. But when you flood the system with tons of oxygen, it messes everything up. It basically tricks the body into reopening all those closed roads. So now you have blood rushing to these broken down factories where there's no oxygen to pick up. And even worse, that blood can't unload the carbon dioxide it's carrying. The result? CO2 starts building up to really dangerous levels in the blood. And then there's culprit number two, the Haldane effect. This one is just as wild. So think of your hemoglobin, the stuff in your red blood cells, as a city bus. When that bus doesn't have many oxygen passengers, it's fantastic at picking up carbon dioxide passengers and carrying them out of the body. But when you hit the body with high-flow oxygen, it's like a flash mob of O2 passengers storming the bus. They shove their way on, and there's no more room. All the CO2 passengers get kicked right off the bus, stranded in the bloodstream, and bam, you get another huge spike in carbon dioxide. That's a condition we call hypercapnia. Okay, so if just blasting someone with oxygen is a bad idea, what's the right thing to do? How do you help someone with COPD who's in trouble? This is where being super precise isn't just a good idea, it's literally a matter of life and death. And here it is, the key number you need to know. For most COPD patients having a flare-up, the safe zone for their oxygen levels is between 88 and 92%. That's it. We're not aiming for a perfect 99 or 100%. It's a very narrow, very specific target. And you have to understand, the stakes are incredibly high. The research is clear. Pushing a COPD patient's oxygen levels above that 92% mark is directly linked with a higher risk of death. That's why getting this right is so critical. Now, knowing how to handle oxygen in a crisis is one thing, but let's pull back for a second and look at the big picture. What's the absolute number one most important step for anyone with COPD? It's simple. Quit smoking. Full stop. It is the foundation for everything else. Of course, it doesn't stop with quitting smoking. Managing COPD is a whole strategy. You've got medications to help open up those airways. You've got that carefully controlled oxygen therapy we just talked about. There's also pulmonary rehab, which is basically exercise and education to get stronger. And then there are the basics, like getting your flu and pneumonia shots and just staying away from things that can irritate your lungs. All right, let's bring this all together. What's the main takeaway here, especially for anyone who has COPD or is caring for someone who does? Here it is. The goal isn't just breathing, it's breathing safely. It's about understanding that the body has changed, and you can't just throw more oxygen at the problem. It's a move away from brute force and towards precision, working with the body's unique needs, not against them. You know, this whole oxygen paradox is such a great reminder that in medicine, and maybe in life in general, more isn't always better. It really makes you stop and question your first instincts. It makes me wonder, what other common sense things do we just accept without a second thought? Something to think about. Thanks so much for joining me for this explainer.